If you want better case acceptance, a great place to start is your team's mindset. I'll never forget back in my associateship, the person working at the front desk was presenting a treatment plan to the patient. So I'm sitting there and I'm kind of hanging back behind the desk and I'm listening. And the patient says to her, "Oh my gosh, this is so expensive." And she goes, "Oh, it's not your fillings that are expensive. It's your crowns that are expensive." And that's when I realized, I said, dude, if my team thinks dentistry is expensive, overpriced, and it's just not worth it to the patients, I think my patients will too. Now, I will admit, yeah, dentistry costs money. Yes, it's not cheap, but what I want you and your team to understand that it's valuable. And it's not just like those big things, like the big cases, like the veneers and the full mouth rehabs that we do. Everything is life-changing, even the smallest things that we do. I want you to think about somebody who hides their smile. Every time they laugh, they cover their mouth, or they're afraid to go out with friends because they're embarrassed about the condition of their teeth. Things like that. Where does that start? Where does that begin? That doesn't just happen overnight. That happens after years and years of neglect, maybe fear of going to the dentist. Maybe they don't have the money or can't come up with the finances. That comes after a long time of not having dental health. So at some point in that person's lifetime, it was just a single filling. It was just a little scaling and root planing, a little gum disease. So those are the things that we often take for granted at the dental office, but we don't realize that that left alone will turn into a really big deal for someone. So it's valuable. So here's the move I want you to make as the leader of your practice. I want you to give your team better stories. I want you to show your team how what they do every day affects their patients' lives. Everything from answering the phone to the way they present treatment to how tidy and neat our practice is. I want you to get them to believe in the value of dental health because it is important. And when you get them to believe that, that belief will start to show up in their speech, the way that they communicate to patients, and then your patients will say yes. And then we get to help more people, which is ultimately what we're trying to do.